Yeah, you can.
Okay. Good morning, Mr. Sims. My name is Hannah. I'll be your nurse today. We're going to be performing suctioning here, so let me go ahead and verify your wristband. May I get your first and last name and date of birth? I will go ahead and raise the patient into high Fowler's position. And then I would check the patient's O2 levels, vital signs. Along with that, I would also hyperoxygenate the patient. After doing that, I would lower the bed rail, and then I would set up my sterile field in order to perform suctioning. We'll go ahead and remove the wrapping of the sterile suction kit. I would remove the container for the saline solution. I'd pour in the saline. After doing that, I would remove the gloves, the sterile gloves. After that, I would throw this away into the biohazard bag. I would then remove the section. After doing that, I would go ahead and measure it to the inner cannula. It's at 9, so then I would add it to 10. I would then wrap it. I would then, before putting on my sterile gloves, I would have turned on the suction machine, so then when I wouldn't have to touch it with my sterile gloves. So the suction machine is on. I would then go ahead and connect this to this. After touching this, my non-dominant hand is no longer sterile. After that, I would go ahead and test suctioning for a few seconds. After that, I would hyperoxygenate the patient again, and then I would be ready to perform suctioning. I would remove the tray. I would then place in suctioning, and then for 5 to 10 seconds, I would then twist the suctioning out, wrap it, and then place on this again. Allow 1 minute of rest and allow the patient to hyperoxygenate. I would then clean this again, suction. After doing that, after 1 minute, I would remove this, put this back in to 10, and then I would twist out 5 to 10 seconds, and then place that back on. And if the patient needed, I could perform this once again, hyperoxygenate the patient, allow 1 minute of rest, and suction again. After doing that, I have completed suctioning. So then I would remove this, discard it. I would raise up the bed rails again, put the patient back into a comfortable position. And after making sure the patient is in a comfortable position, I would record how the patient tolerated everything. Along with that, I would chart how many times I had to suction, and that would be it.